HealingYourself.Life provides information for awareness, educational, and support purposes only and does not diagnose or prescribe treatment for any medical condition. Viewers are encouraged to do their own due diligence and consult with their own medical caregivers before making personal treatment decisions. Welcome back to HealingYourself.Life. We are with our off-grid Dr. J. Nielsen, MD. He has a practice in Northwest Ohio and a survival compound in Haiti and a Christian mission there. He's here to talk to us today about inflammatory bowel disease, IBD, or irritable bowel syndrome, IBS. We'll make the clarifications, and Crohn's and colitis and all kinds of things. You'll narrow it down for us so we can understand the distinctions there. It affects a lot and a growing number of Americans. And can you break it down for us and tell us what it is we're not hearing, what we need to know?
Well, it's interesting when you look at the life history of a patient who ends up having inflammatory bowel disease, Crohn's or ulcerative colitis. They have usually spent months to years thinking they had irritable bowel syndrome or something, okay, that they didn't recognize. And a lot of times it's the appearance of blood. Blood has a tendency to wake people up and go time to get scoped, and scoping leads you on to diagnosis, frequently in IBD. And so it's important to see that this is a trail from a spectrum from mild to very severe. And your objective, if you have this disorder, is to get down that spectrum, okay? And have less symptoms, because as it currently stands, except for my very last thing I'm going to talk about, I don't believe there are any cures for this. Until my very last thing, then I think I'm seeing some cures. And so, as I always do, I always have something out of the news that kind of tickles me, and this one will circle back and be a part of this talk. This was in the news yesterday, that the soaring amount of SSRI antidepressants in water, in seawater, is starting to affect sea animals. What, you don't think it infected us? I mean, come on, in our local water, you can see Cipro and the styrenes from your water bottles and your birth control pills, they all show up on gas chromatography, okay? And so we want to sit down and go, what is the complex of symptoms that we're talking about? And we're talking about, as a general rule, diarrhea, although you do see people with constipation from both irritable bowel and inflammatory bowel disease, but mostly diarrhea, mucus, bloating, cramping. When all of those really get going, loss of appetite, bladder pressure as the bowel gets messed up, and finally, possible bleeding, bowel obstruction, perforation of the bowel with peritonitis like a ruptured appendix would. And all of those things are on that spectrum, okay? And so when we talk about irritable bowel syndrome, anytime I've told 1,000 patients this in my life, they say, my doctor told me I have irritable bowel, and I go, wonderful. I said, you've really got a sharp guy there. Okay? The next time you see him, ask him a question for me. Now that you figured out I have irritable bowel, what's making it irritable? He'll probably throw you out of the office. Okay? Because like chronic fatigue and fibromyalgia, it's a garbage diagnosis that justifies throwing you on antidepressants and going, I'm done with you. It's all over. Okay? I'm not going to put a lot of time into irritable bowel, because if you want to get irritable bowel better, do all the things I do to Crohn's disease. It works even better in irritable bowel. We're not going to touch irritable bowel tonight, okay? When we talk about Crohn's and ulcerative colitis, the two disorders that we divide inflammatory bowel disease into, we are talking about Crohn's disease, and you can see there on our little diagram that Crohn's disease is called regional enteritis because it does not hit all of the bowel, it hits sections. And Crohn's is interesting because not only will it hit your colon, but it can be in the esophagus, it can be in the lining of the lung, it can be in the gastric lining. These are all rare, but they've all been documented. It is an involvement of the entire gastrointestinal tract. Whereas the opposing view, ulcerative colitis, is much more shallow ulcers than deep punched out holes and tends to involve all of the colon, right? Okay. And of course, one of the things that we said already is once you start getting down this path, you start getting endoscoped, colonoscoped, usually both upper and lower, because there's twice as much money if you do the upper, okay? And this was published in 2013 that well-cleaned colonoscopes are spreading toxigenic E. coli. And I didn't see anything happen after that they went, well, we found a new way to do that. Okay.
Gee whiz.
Yeah, right. That kind of made me kind of curled my toes when I printed that today and I forgot that. Okay. This is important. Inflammatory bowel disease is becoming more common and getting younger. Younger and younger people are being diagnosed with it. Okay. So what we're getting, if you walk into a traditional doc, you're going to see that you're going to get cortisone, sulfasalazines, and then put on immunosuppressive drugs. Imuran. Now we've got Entyvio and all these new drugs that are going out. And here's the American Academy of Family Practice. They occasionally come up with one-pagers you can put in your desk drawer and go, what is it I ought to do to this patient? And this one's about 2 years old, and half the drugs on here are all immunosuppressives like Imuran. Yeah. Okay. This was the front cover of the American Academy of Family Practice Journal about 5 years ago, and this is about irritable bowel. Okay. And if you look at that chart really carefully, you'll see that they think you're crazy. Irritable bowel syndrome, behavior, emotional, cognitive, that's 3, all crazy, and physiologic, okay? So whoever made this little drawing thinks that 3 out of 4 irritable bowel patients are crazy, which is why everybody keeps coming into me on an antidepressant and they're not any better, okay? And where that's all headed is they must be ready. There's Entyvio. We see the ad. There are so many ads on TV. It makes you feel like there are a million cases. But then again, we said this about psoriasis one night. There are a million ads on TV for psoriasis immunosuppressives, and I can't very rarely see a case. Saw a case of psoriasis yesterday, but not very often. And so here's an article, American Academy of Family Practice. Boy, this is a tough problem. A lot of challenges, hard to treat. None of our therapy seems to work. Okay? Well, my story with IBD starts really, really early because when I was in medical school and residency, we only had one surgeon in northwestern Ohio who operated on Crohn's and ulcerative colitis because the surgeons are all terrified of it because they end up with fistulas, they end up with non-healing wounds, they end up with lots and lots of complications. Right. And once you start operating on an IBD patient, you, except for total colectomy, you're in trouble. That wherever you put your incision, you're going to get a fistula to the surface with poop draining out of your wound, and then and it was just a mess. And I spent 2 months on this man's service. He truly was the best I've ever seen. He's dead today. Great. He's from Cuba. Great doctor, and he got terrible complications. When I talked to other good general surgeons, they would gladly send it away and say, let him do it. He does a lot of them. I don't want to do it. This terrifies surgeons. So when you get an acute bowel obstruction in the ER in the middle of the night and your general surgeon gets called in to see you and he has to operate, he has no experience because he's always sending it away. Okay?
I was the patient in that
scenario. Yeah. And so this is my training. This is my experience. I haven't really learned a lot about anything. And when I moved to Sandusky from my training, the very first thing I did is I ended up with an entire family full of ulcerative colitis. And they say this isn't real hereditary, but every child in this family had it, and the woman who was the sickest in the family actually had a baby die intrauterine that we did an autopsy on. It died at 7 months gestation, and that baby had ulcerative colitis. And I went, well, that's pretty inherited to me, Mom. I went, hey, it's pretty straightforward. And I sent all of this family into Cleveland to specialists, not the Cleveland Clinic. And this guy in private practice saw this patient and sent this patient back with this drug, mercaptopurine, pyranethanol. And pyranethanol is a metabolite of a drug called Imuran that has a lot of side effects. And if you kept this dose really low, you got no side effects. And by the time I left town 13 years later, I was taking care of every IBD patient in the 4-county area because the word was out that you didn't have to have your hair fall out and have all kinds of bad things happen and go to Jay and he'd fix it. And that was the only thing I did. I put people on pyranethanol, got it working, lowered the dose immediately, got it as light as possible. That was my only treatment. And for years, I was pretty happy with myself because my patients weren't going to surgery. They were doing pretty well. And then in 1993, the next thing I did after I left Sandusky was I went into integrative medicine and started learning about bowel health and all of those things you learn when you're an alternative medicine doc. And the very first thing I learned was this test. Changed my life. Used to be called Great Smoky's Lab. It's now Genova. And what this is this does 4 things. It tests digestion, absorption, inflammation, immunology, the gut bacteria, and parasitology. And that's, if any of you'd like to take a screen capture of that, so you got it. Yeah, I'm holding it okay. And I'm going to real quick show you what this test looks like, 1 page at a time. It comes with 4 columns, and those 4 columns represent these 4 functions. And then here comes the test. It's quite long. Not going to bother to look at that. Lots of arrows, lots of more arrows. What these are telling you is when these tests are up and down, you can start narrowing things down into this is fat loss, this is IBS, IBD, metabolic syndrome, chronic fatigue, autoimmune, type 2 diabetes, high blood pressure, and mood disorders. This test will separate those for you. And then this is one of the important ones, right there. And what this does is this tells you all the fat in your stool, and then it tells you 3 tests I'm going to cover next, calprotectin, EPX, and secretory IgA. And then, I'll skip that one, and then it grows all of the bacteria. When you send a stool culture to a hospital, if it doesn't grow something bad, they just tell you normal flora. Okay? There's no normal flora at Genova. Everything that's grown comes back telling you whether it's a pathogen, a non-pathogen, and whether it's 1, 2, 3, or 4 plus in volume. And then it also, as you see down here, tells you about all the fungi that grow in your bowel. Very important, okay? And then this company is all the parasitologists from the CDC. They got fired after Dr. Sabin took the CDC, went from private to government because Jimmy Carter was mad about the flu vaccine.
Right.
So all the parasitologists all started this company 40 years ago. They are the best parasitologists in the world. They frequently will find a couple parasites in a patient that I've sent to the hospital over and over again, and all the studies were negative. And so that's one of the tests. Now, a new test has come out, and this one is called the GI map. And I just started doing it 6 weeks ago. And it grows all the bacteria and clusters them into what's called biomarkers and tells you all kinds of interesting things about the pathways that need repaired. I haven't learned to do that yet, but a buddy of mine is getting really good at it really fast, so I've been sending them to him. So this is, if you're going to do one test and you want to know that you're irritable bowel or inflammatory bowel disease, the next tests are going to tell you a lot about it. These are the 3 tests I kind of glossed over, okay? The first one is, and the most important, is a test called eosinophil protein X, EPX. This is the inflammatory marker that goes up in Crohn's and ulcerative colitis.
Okay.
If you can pass this test, you probably don't have IBD. Okay?
Now,
if you flunk this test, you probably do have inflammatory bowel disease.
For those who have flare-ups of their IBD, if they're in a period of remission, Do you know how this
It would
test-
get better, but not go back to normal.
All right.
Okay. Normal in this lab is less than 4.6. Most of my newly diagnosed IBD patients are 50.
Mm-hmm.
I do all my magic and try and get them better, and they say they're fine. I get a 13. Normal's 4.6.
Okay.
Okay. And you can look this up, but I made this one for those of you who like to do screen captures. And this is just a description of EPX. And all of this is on the Genova website. If you put in Genova 24-hour GI effects test, EFF effects test, you'll actually be able to pull down a sample report, and there's a PowerPoint to look at. Really, really useful stuff. The next test that's in that little 3-panel in the middle, we're getting used to seeing on TV, Cologuard. Okay? The calprotectin test.
That little friendly box with a G on it.
Yeah, right. The guy, the box sitting on a toilet, right?
Yeah.
This test is like new in America, right? I've been doing this test since 1984. The Europeans don't even do colonoscopies for routine screening for cancer. They do a Cologuard, and if the calprotectin test is negative, they go, you don't need scoped. I mean, if you're looking for cancer.
Mm-hmm.
If you're looking for other stuff, sure, you need scoped. The nice thing about this is that inflammatory bowel disease greatly increases your risk of colon cancer. If I remember, it's like 20 times more common, okay? So this test rather tells you how much your risk is for getting colon cancer. The normal for this test is less than 120, okay? And 50 to 120 is you better be careful, so 50 is really the normal. I just had a patient the other day that was 2,000.
Okay.
You're off to being scoped, and et cetera. The next test that's interesting in there is pancreatic elastase 1, okay? And PE1 goes lower and lower as your pancreas makes less and less digestive enzymes.
Okay.
So if you don't pass this one, okay, you have pancreatic insufficiency. We see that on TV all the time, right?
Yeah.
Me too.
Yeah.
Alcoholic, okay? A long time ago, but wiped out my pancreas. That's what stopped me. And digestive enzymes, help me immensely, okay? Can't not take them, right? Okay? And of course, if you have inflammatory bowel disease, you're going to have pancreatic insufficiency. Those two go together.
This is for my supper. My pancreas.
So my pancreatic enzymes. Okay. The next one, okay, is fecal fats. Now, there are lots of reasons to have fats in your stool, but number one is not enough lipase. So if your fecal fats are elevated, then you need to be on an enzyme that contains a lot of lipase. I like LipoGold, okay, and Digest Gold for routine stuff, both by integrative, wonderful products. And then I'll pull one up. And if you're having a lot of fat in your stools, fat never should have made it to your colon.
Right.
Should have been taken out in the first 3 feet of your jejunum, right? And so this is one of the symptoms I still have. I can kind of monitor my pancreas insufficiency because every once in a while I'll notice that with a stool that I'll see a little bit of oil on the water.
Yeah.
Okay. And that's never normal. And so now you want to know is that triglycerides, long chain, cholesterol, or phospholipids, and a total. And you can see this one's abnormal. Normal's under 36, and it's 102. Okay, and these are all in color. I only have a black and white printer here at the office, so you're not going to get to see all the pretty colors. This is a guy that came to me. He's had Crohn's disease since he's 15 years old. The first time that I did the Great Smokies Genova 24-hour GI effects, then called Comprehensive Diagnostic Profile, he grew 21 bacteria.
21 different species?
And 13 of them were pathogenic. This is his last one, and there are 2 pathogenic. We can't get rid of that, Morganella or Klebsiella, but we're down to 2. And he was almost asymptomatic, okay? Is this, I've got a real case here. I've got to be careful. There's no name on it. There's no name on it. The next thing that's on the test is parasitology. And this is a patient who came to me and said they had ulcerative colitis and they were growing moderate blastocystis hominis and many Dientamoeba fragilis in multiple stages. and I put this patient on 2 anti-parasite drugs for 3 days, and they never had inflammatory bowel disease again. 20 years they were sick. Nobody did a parasite test.
That just hurts.
It just hurts, okay? So this is all in that test, okay? This is, really significant. So we're going to leave Genova here, and we're going to go back to talking about IBD and what works, okay? One of the things you have to recognize, I already pointed out the Candida albicans in that test, is that traditional docs in their literature are being told, think fungus. I've never seen a gastroenterologist think fungus, but this is out of their literature. This is out of the journal, okay, their journal, okay? And here we go. This is out of sequence. I'll go back. This is DNA-based colon cancer screening hits 80%. That's better than a colonoscopy. This is Cologuard, okay? This is a very old article from my family practice journals. So why are we getting this? Why are we seeing this epidemic, younger, etc.? Okay, and there's all kinds of things here. And did I put this all on the back or put it here? We've got all kinds of causes, and this is out of Wikipedia. I don't know for those if I've said this before. I probably have, but 10 years ago I told all my patients, don't ever look on the internet for information. Nothing's right on the internet. It's not true anymore. There's so much competition out there that you can just use Wikipedia. I very rarely, I might agree in the severity or the degree, but I very rarely find Wikipedia to be medically wrong, and find all kinds of things there. So what they're saying here for cause is post-infectious, meaning I got intestinal flu and it never went away. This is for irritable bowel, not for Crohn's. And I got stress, and I got bad bacteria, and I got fungus, and I got parasites. Well, if you got parasites, you don't have irritable bowel. You have parasites. What are they going to do? Let you keep them? Okay. And so, why is this happening to us? Why are we having this massive epidemic? Okay. This is a very old article, and it should have shocked the world. Okay. Oral contraceptives and antibiotics on a long, major longitudinal study came up as the 2 risk factors. If you've never been on birth control and you've never taken an antibiotic in your life, it's almost unheard of for you to have Crohn's or ulcerative colitis. And as I tell moms all the time, they bring their child into the office and the baby's got the sniffles, and they go, "Oh, doctor, please give me a broad-spectrum antibiotic." And I go, "You're about to kill the 2 best friends this baby has, Lactobacillus and Bifidobacterium. You're going to take 1 capsule, 1 teaspoon of antibiotic, and your child will never have their natural bowel flora again." There it is. And here's it is coming back. This is overuse, injudicious use of antibiotics by pediatricians and family doctors. Here's another one that came out. They got real specific. Flagyl, metronidazole. Using it linked to getting IBD. Here's another one. Proton pump inhibitors, Nexium, all of the acid pills for your stomach. They're all causing bacterial overgrowth and screwing up all the bacteria in your bowel. And we started out with this article. Even the seawater's got SSRIs. SSRIs completely screw up your bowel flora and cause bleeding. Okay? So when we take that, and then we take the fact that after Bob Borland won the Nobel Prize for solving wheat rust in Africa and stop the starvation in Africa, Nobel Prize, congratulations, good job. How'd he do that? He changed it to genetically modified wheat. And now 99% of all wheat in the United States is GMO. What did he change? Well, I don't know what he changed, but in the end, he changed the protein structure of gluten. Gluten became a food at the time that the Jews were building the pyramids in Egypt 7,000 years ago, and they needed a food that wasn't fresh and that could keep for a couple days, that you could hand to somebody you didn't care much about and say, "Here, eat, make bricks." Okay? And when this food became available, I guarantee all those Jews all had diarrhea because gluten is indigestible. We're not talking about celiac disease here. We're talking about gluten intolerance. None of us tolerate gluten. We've now had 7,000 years to learn to eat gluten. And 12 years ago, Bob Borland changed the gluten. And now everybody's gluten intolerant. I couldn't find a case of gluten intolerance in my practice 30 years ago, 20 years ago, 15 years ago. 8 years ago, now everybody's got it. Once that wheat hit 99% GMO, most of my patients who come in with GI problems, I go, get off of all gluten, not just bread, because gluten is hiding in lots of, gravies and mixes and bouillon cubes and coatings and all kinds of things. You really got to get on a website, get a list of all the gluten-containing foods, and not one molecule for 21 days. It takes that long. And then when you go, wow, I'm better, I go, no, you're only halfway home. Go do the Twinkie challenge. Go do the croissant challenge. Go pick something really, really full of gluten and have it. And guess what happens? You hurt all over and you immediately have diarrhea because your bowel is adapted back to not being poisoned. It's lost its adaptation. And I go, now you got gluten. Don't eat gluten. And so gluten is a cofactor in all inflammatory bowel disease. And nobody who has inflammatory bowel disease, because gluten's the most indigestible thing in the world. That's why it's such a problem. This is a real nice book. This is the cover of it about 10 years ago, so don't yell at me about the fact that it's called something else. It's called Breaking the Vicious Cycle. The author is Elaine Gottschall, okay? And I would imagine that this has been republished, talking more about gluten, but it says right there, new supplement, the celiac story. So I'm definitely in a second edition here. This book was written just as the celiac issue was coming out. Now, I'll bet you she agrees with me. The other one, my favorite dog to kick around the living room, stevia. Indigestible in all guts, but if you put it in IBD, you're going to get punished. No stevia, no artificial sweeteners. Of course, co-infection with Candida is a huge issue in Crohn's, and so the plain answer is you should be gluten-free, but the plain fact is the right diet is carb-free. Because Candida can't eat protein and fat. It can only digest carbs. And so if you give no carbs and no artificial sweeteners and no gluten, your dietary-wise, you can watch half your symptoms go away and you haven't even figured out what's going on. Okay? And that goes, this was a nice article. Somebody tried to say, hey, why don't we be logical and not give Imuran first or give, any of those immunosuppressive drugs. Low-tech options, okay? This is interesting. I've talked about artemisia many times because I grew up for Haiti. And here's a study that shows that artemisia treats inflammatory bowel disease. I got real excited because I had a Lyme patient who also had Crohn's. And I gave this patient artemisia to try, and the Crohn's went away. And I thought, oh, I found the cure. But it never worked again. I gave up. I did 30 people and it worked one more time and I went, it isn't worth it. Okay? And the reason that artemisia is working is because it's working on TNF alpha, which is exactly what Humira and Entyvio are working on, which was fascinating.
But this is low cost and low profit.
There's no profit in that artemisia, right? Okay. There are many, many treatments that have been discovered to work in inflammatory bowel disease and then have been banned. Okay? And one of them is fecal transplants. So you're sick and your wife isn't sick. So you collect her stool, you dilute it with some water, you shake it all up, you put it in an enema bag and you run it into the sick person's rectum and you keep doing that over and over again. And it works really, really well. And so they made that illegal. Kind of like bestiality and things like that. They went, no, in the privacy of your own home, you can't put your wife's stool up your rectum. That's illegal. You've got to go to the Cleveland Clinic.
I see the procedure, as you described it, could totally be done in a home setting. Yeah.
Absolutely.
I wasn't picturing that. I was picturing a clinic setting.
Yeah. And so the FDA said, nope, got to do it at the hospital. And then they did at the hospital, and I sent 2 patients up to the Cleveland Clinic, and they did great. okay? And they really carefully pick their stool, okay? And then they went, oh no, the hospitals are doing it. We've made it illegal. Now you can't get it. What could possibly go wrong? If you're only going to listen to 30 seconds, this is it. You already know this, how I feel about this. All integrative physicians sell probiotics, okay? All probiotics come in a bottle. They were made in California 90 days ago. They spent one night in a truck in Texas with 130-degree temperatures, okay? They've, been frozen. They've been whatever they are, but whatever they are, they're freeze-dried and they're sitting in a jar with no oxygen. The concept that these bacteria are being put in a gelatin capsule, dropped into hydrochloric acid, your stomach contents, and one bug lives is amazing. These things are old, they're dry, they're old and dry, okay? If you take your probiotic, buy it in a bulk form. I use Orthobiotic 4000 in my office. It's by a very reputable company, Orthomolecular, okay? And you go get some almond milk or some kefir, not the diet crap, but the stuff with sugar in it, because these bacteria are looking to be fed. All I'm doing is giving you water and sugar in a palatable form. And you put a scoop of it in a small container, fill it up with your almond milk, shake it up, and set it out on your countertop for 5 hours. What you're doing is you're letting it warm up and let the bacteria be fed and replicate one time. And now instead of 90-day-old dehydrated bacteria that are going in hydrochloric acid, you are now making brand new bacteria that have replicated, are healthy, and you're putting it in food so it has a shot. And then you just take that thing and what I always tell people is make tomorrows. Every time you make it, make tomorrows, set it out for your 5 hours, put it in the refrigerator, and every day you make tomorrows. If you try and make 3 or 4 days at a time, and I do that because I'm lazy, okay, they don't taste so good on day 4. They start getting kind of like yogurt that got the lid left off. They're a little, you better be tolerant, okay? They still work. They actually work better because they're more cultured, right? Kind of like sour cream, okay? And if you do this, I have had inflammatory bowel patients who were scheduled for a colectomy. This is right after I went in practice in integrative medicine. I had a lady, and I told her to make her, back then I told people to make their own yogurt. Oh my God, it tastes awful. And I told her, make yogurt and do this. And this was on a Thursday, and she had her colectomy scheduled on Monday, okay? And I put her on a supplement I'm going to show everybody. And she took 1 dose, her diarrhea stopped. And by the end of the weekend, she didn't have any diarrhea at all and no blood. She canceled, and she's still my patient today, 25 years later, and all she does is take the supplement. One of the things you have to be ready for is that most inflammatory bowel patients have been given a lot of cortisone. And cortisone destroys your adrenal gland, and this is the salivary test to see if your adrenal is working. It's called a salivary 24-hour diurnal analysis. I use a company called ZRT. You can go up on ZRT and put in ZRT salivary cortisol. It's not covered by insurance, so you can buy one yourself. They'll ship you a kit. You get the results. Okay? Here's an interesting, this research is 30 years old. DHEA replaces cortisone. This is what, an $8 supplement out on my shelf right now? Okay? And this was in lupus, but what they were doing was using DHEA to get people off of steroids. So I read this, 2001, and I started taking all of my IBD patients and putting them on high-dose DHEA. Whenever you do a DHEA sulfate level, DHEA, yes, not DHEA, got to have a sulfate on it or it's the wrong test, and you get a DHEA sulfate on an IBD patient, it's always below normal.
Any difference between men and women in the way you would dose?
Yeah, I'm going to give the women 10 times as much as I would usually give, and I'm going to give the men 10 times as much as I'd usually give them. So it comes in 5s and 25s, and I'm going to put the woman on 50, and I'm going to put the guy on 200-300. Okay? And then I'm going to check levels and go, oh, my levels are normal. It's being eaten. It's being consumed, okay? And then as they get better, you have to back off. You have to keep doing lab and back off. I had a girl, she'd had IBD, don't remember which one, for 20 years when she met me. And at my first visit, while I was waiting for everything else, I put her on 20 milligrams of DHEA, and 2 days later, she didn't have any symptoms. And to this day, I still take care of her. She's down to 15 milligrams of DHEA. She's tried to stop it twice, and both times within a few days, she's recurred. And it's the only thing we ever did except for making our own yogurt. And she's fine. And she'd been on Imuran and Humira and cyclophosphamide and all kinds of terrible drugs.
It has an anti-inflammatory effect?
No, remember, DHEA is an adrenal hormone. It's a precursor to testosterone, but it's an immunologic modifier that is improving your immune system.
Improving your immune system.
Right.
Interesting.
It's anti-cancer. DHEA is your anti-cancer hormone, along with progesterone.
Interesting.
Okay. Here's another one. I have a patient who's been to Europe twice, and they give you a dog parasite. Have you done that?
Porcine whipworm, TSO.
Did you do it?
Yeah.
Yeah. And what did it do in you?
Fabulous.
Yeah, right. This guy's done great. Okay. And the Cleveland Clinic was doing it, and they've stopped.
The study was being done out of the University of Iowa too. They had done a University of Iowa study. They were going to go national. They presented their initial findings at a gastroenterologist conference in Louisiana, and the FDA shut down they never got to do their nationwide study. And I've corresponded with the doctor since then. And anyway, but now you can get it over the counter at ovamed.de. So if people go to ovamed.de, ovamed.de, you can buy your own because it's not considered a
And
drug.
I take it that's a European website.
Yes.
There you go. Yeah, because that's my patient just went back to Europe and got it. So that's really great information. Yeah. Thank you, sir. I told you about my girl who all she's on now is yogurt and a supplement. This bottle's very old. It won't look like this anymore. This is, again, an orthomolecular product, and it's called mucosogen. And I have the greatest story, and I've told this story more times in my life. I had a nurse practitioner 20 years ago, and I had this girl, and she had Crohn's, so she had fistulas out of her rectum, okay? And she's in to see my nurse practitioner for a pelvic and pap smear. And she was a really good nurse practitioner, very competent. And she said, you got to come over and look at this. I've never seen this. And I walked in and I said, if this patient would have told you that she has Crohn's disease, you'd have known that's a healed fistula. And the patient said, I forgot I had Crohn's disease. Is that why I'm still taking that supplement you told me to never stop? Could you imagine saying, I forgot I had Crohn's disease?
That'd be a lovely thing for
people to say. And she had fistulas, okay? I told you about the importance of digestive enzymes. Love this product. They won't sell to physicians, so I don't carry it in my office. It's by Enzymedica, and this is Digest Gold, and the reason I like it is, how many capsules did you hold up?
A lot.
A lot.
Yeah.
Sometimes one of these does it. You can have that one, okay?
Thanks.
If you're getting fat in your stools, the same company makes Lipo Gold, LYPO Gold, same company, same label, but it says Lipo Gold. Wonderful product.
Okay.
Love it. Okay, told you I was going to tell you about healing, okay? 6 months ago, I got to go back a year. A year ago, my biochemist quit going to other meetings and started only going to meetings about peptides. You've heard me talk a lot about peptides, Arthroben for arthritis, etc. Okay? And when I know more, one day we'll do an entire hour on peptides, but so far I don't know enough to talk about them. Okay? But we're in my wheelhouse now with this one. Okay? And after this had gone on for a half a year, Jack came to me and said, you got to get certified to do this. Okay? And I went, what do you mean certified? I'm a doc, I just write it. He said, no, it's not how it works. You have to make an application to the FDA. And I went, oh, this is going to go well. Everybody on here knows my history with the FDA. I got blackballed for whistleblowing, right?
Yeah.
And I went, Jack, I don't think that's going to work. And he said, well, we got to try. So I called the company up, and the company said, send your whole resume. And of course, my whole resume has the fact that I started the first contract research organization for alternative medicine with 53 doctors and started 2 investigational review boards and did 47 phase 2 and phase 3 trials and ran a laboratory that did 1,000 microbiology trials. And, my FDA stuff is all over my resume from 1983 forward for 13 years. And ends abruptly, by the way, very, very abruptly, okay? And I sent all that stuff in, and the girl said, okay, here's what happens. You got to give me 3 hours on a day off, and I'm going to be on the phone just to facilitate, and we're going to connect you with the FDA, and there's one guy at the FDA, and you wait in line to be interviewed, and here you go. And then you make it or you don't. I said, what's my chances? And she said, some people make it, some don't. I can't quite figure out the criteria. She says, university people make it. She says, private practice people don't. That's against you. Okay? I said, okay. So I'm sitting here with my headphones on and my GoToMeeting thing up, and I'm looking at her website and all of this stuff, and this guy's going to come on and do this interview over the digital divide. Okay? And she says, I'll be right back in 3 minutes. 3 minutes turns into 10, 10 turns into 20. I'm kind of checking my monitor, moving my mouse, trying to figure out if I've got a live system. And finally, my phone rings. And she comes on, she says, Dr. Nielsen, this is Wendy. And I said, yeah. And she said, I don't know quite what happened here. I've never had this happen before. And I thought, well, here we go. Okay? Yes, because you haven't run into Jay. Okay? And I said, then I thought, okay, I'm done. I thought, what did they do? And she says, they don't want to interview you. And I said, okay, I'm not surprised. And she said, yeah, they said you're good to go.
Oh.
I think they looked at my resume and went, hey, 13 years of research, this guy knows how to do a protocol.
Yeah.
That must be it. And obviously, the FDA, if you're out there listening, it's Jay Nielsen. You fired me. Look it up. It's in the files. Okay? So they forgot it. Okay? So I joined the people at TaylorMade. Okay? And if you type in TaylorMade Compounding, not T-A-Y, T-A-I-L-O-R space M-A-D-E compounding, you're going to come up to that face page. And you can download stuff, and good luck reading it. I can't read it. And I've been sent just 1,000-page PDFs with the research on things. Okay, story number 2. My big peptide is BPC 157, okay? Go into Google Scholar, type in BPC 157, and you will find thousands of research articles. This is the most researched peptide in the world. It's been out there quite a long time, and it's just now getting released by the FDA. These products, you're injecting 1/10 of an ml underneath your skin once a day for 40 days. That's what comes in the bottle, a 40-day supply. It does 2 things. Effects on healing. Well, that's kind of broad, okay? It does 2 things. It fixes ligament, and it's made from guinea pig gastric mucosa. That's where they found the peptide. Every one of these peptides has its source, okay? They're all 10 to 20 amino acids, so they're hypoallergenic because they're short, okay? And this one makes tendons heal, and it makes inflammatory bowel disease go away. Okay? And we're going to tell stories about that during our closing 5 minutes here. Okay? And so this product is out. Well, Jack's best friend is the guy with the 19 bacteria that I've gotten down to 2, and he's better, but he's got this, and he's had multiple surgeries and fistulas, and his abdomen's all carved up. And he said, Doc, I'm first boy on your block. Let's order it. A couple days later it came. 14 days later, Jim walked in my office, and his abdomen had been completely transformed. Where his colostomy was, it wasn't red anymore. It was flat. He had incisional hernias that were like, poked in, and they'd let go. He's still improving. We're now 4 months out, okay? And we sent him, where's my article? Come on. Right there. And there is a letter from his gastroenterologist stating that the insurance company can take Crohn's disease off of his name because he re-scoped him a month later and he didn't have anything. Well, I had a young man on his way to the Cleveland Clinic to have a colectomy.
Oh my God. Having a serious disease like Crohn's taken off your record
It's impossible.
So that you can get insurance?
It's impossible. It's absolutely impossible.
That's a major deal.
So Paul's on his way to the Cleveland Clinic. He's bleeding himself to death. His hemoglobin is 6. He's in major trouble. I've given up. He's on his way to the Cleveland Clinic. And I call Paul. And I go, Paul, come in. And I tell him Jim's story. I said, let's order some BPC 157. It comes. 14 days later, Paul's great. And he's on the schedule 14 more days away to have his colon off, but the Cleveland Clinic has a policy that we scope you the night before we operate. I said, perfect. And they took Paul into colonoscopy, and there's his colonoscopy report. 11 biopsies, all normal. And they walked out and said, got no idea what happened to you, but you don't need a colectomy. But he had such a severe stricture in the last 13 inches of his ileum, and it was a string sign, and he was having bowel obstructions, and he called me up and said they want to do just a regional thing. And I said, hey, you're not inflammatory right now. You're not going to develop a fistula, the BP 157. And he had it, and he's great, and they took out the stricture, and he healed wonderfully. Okay? Now, here's the bottom line on this. This product has been on the market for 6 months before that. And the company told us, we can't get you BPC 157 because all the professional athletes are using it.
Really?
Now, we all know, if we follow Tiger Woods, that Tiger Woods had stem cells, Tiger Woods had microscopic discectomy, Tiger Woods had PRP, and how did that all go? Tiger Woods still sucked. And all of a sudden, in the last 6 months, Tiger Woods won the FedEx Challenge 2 weeks ago. I guarantee you he's doing BPC 157. It makes tendons heal. I'm going to start putting it in my PRP. Huh. Fascinating stuff.
Interesting.
End of story. It can now be cured. Ulcerative colitis and Crohn's disease. My management is do the stool test, get people stabilized, start BPC 157.
What's the risk and cost?
I don't know the cost yet because everybody I have doesn't care about the cost. What we're trying to do is figure out minimum effectiveness. Paul right now is doing 3 days on and 5 days off. So he's managed to get down to...
I see. So it's not just one course of 40 days.
It's 40 days and then you stop and you're going to recur someday.
I see.
And so what we did with Paul is then for 2 months, we went 3 days on, 5 days off, and he did okay. And a month ago, there's an oral form of BPC 157 that won't work for the tendons, but it will work for the
Digestive
IBD.
system.
And I have a source of it. It's less quality, and it can't be injected, but it's really cheap. And right now, I have 2 patients who are on that, and they're still doing okay. I'll get back to you in a couple months. The base cost for the trial for the first 30 days is $350 to find out if it works.
Just for that doesn't count
for the 40 days.
The doctor's cost. That's just the prescription itself. You have to first you got to get a certified doctor.
Yeah, sure, you got it. Yeah, sure, right. You're gonna come in and see me and get a new patient visit.
Right.
But after that, yeah, if you got proven IBD, I go, okay, here's the first thing I do. The first visit, I'm gonna go. Come on, why would I do anything else when I got that?
Well, what about risk though? Let's talk about that.
I can't find any.
The studies that you've looked into?
It's just a peptide. It's such a short peptide. They're all growth hormone secretagogues, okay? And they're finding normal human growth hormone secretagogues that already exist in the human body, and they're finding places to take them from something else, like guinea pig stomach lining, and they're cleaning it up. And so I would think I'd have allergies. There are lots of these peptides. I have 2 patients with multiple sclerosis that are on CJC. Got an email this morning. This lady said, order me another month. I just keep getting better. I got a lady who's got some genetic muscular disorder, and Jack recommended a peptide I forgot was on a list, and she sent me an email 2 days ago. Said, order me another month. I'm getting better. This is the future of medicine. Guess what the FDA is going to do about this?
That's what I'm concerned about.
They're going to cancel it.
So we got to get this story out big time.
And that'll help the FDA? Sure, that's going to work.
No, that'll hopefully educate the populace.
Right.
They won't take it lying down. Well, that's been, and I also would underscore people that they can get the TSO, Trichuris suis ova, which is over the counter, and it also has no published side effects. to help moderate the immune system and get some significant relief.
Everybody I've done it on has done great.
So.
And then they relapse after a while, but the relapse is really slow, 3 or 4 or 5 years.
Yeah.
Lasts for a long time.
Yeah.
And you don't get parasites from it.
Right. That's right.
Yeah. We don't know what it's doing, but you don't get the dog parasite. As it goes through, it makes something, and maybe it's BPC 157. How about that?
That would be interesting, wouldn't it? We've been speaking with Jay Nielsen, MD, former FDA researcher and now FDA certified peptide doctor. About
FDA overlooked.
about inflammatory bowel disease. And this has been a very interesting subject for me because I've had it since 13 years old and got some relief from TSO. The surgeon who took out my terminal ileum and cecum and appendix told me, he was scolding me afterwards saying, you should have been taking your immunosuppressive, you should have been taking this. He says, this is not a surgical problem. I can't correct this surgically. You've got to start dealing with this another way. I just didn't want to take all these immunosuppressives, so kept seeking another route.
Well, they give you cancer.
Yeah, that's not helpful.
That's not helpful.
And the cortisone isn't when you take it too often as well. So thank you very much for enlightening us on some much safer and more effective options for IBD. And we'll come back on another time to talk about, we haven't talked about diabetes.
The list is getting shorter,
Diabetes is one.
Yeah.
And
I love diabetes. Diabetes is completely curable.
Well,
great stuff.
We'll get on that soon.
We can do that.
Very good. Thank you, Dr. Nielsen, for joining us again on HealingYourself.Life.
You're welcome.